Hey everybody, Dr. Cole here, and today we're going to talk about how to use your elbow brace. The hinged elbow brace, you might have this on if you just recently had elbow surgery, if you have some type of elbow injury. And so, first things I want to talk about, this is an elbow brace. This part goes on the outside part of the elbow. And first things first is to talk about the length. So basically we're going to want this circle part to be right at the hinge of the elbow, and this part here is going to end right above the wrist crease. So right above the wrist is how far this is going to go. And on the arm portion, it's going to go right above the mid aspect of the arm. So this is kind of the length that we want, and this should be adjusted for you before you even have the brace on, right? But if you do, so for some reason need to adjust it yourself, so you can kind of zoom in here. There's this little kind of dial here that you need to turn, and that can adjust this in and out. But again, this is typically set for you before you actually have the brace, right? We set this for you in the clinic. Next things to note about this is once you have the length, and this is supposed to be right at the elbow joint area, the easiest way I find to do it is to put this strap on first. So to put this strap right after the circle or the dial is to strap this one. So these are gonna have Velcro. Let me undo this. So this is gonna have a Velcro here that goes into this hook right here. So again, it's gonna come like this. You're gonna see these pads that go around the arm, and this is gonna go, and it's gonna go inside of this hook right here. You're gonna pull it, and you're gonna tighten it down. You might have somebody help you out at first to put it on, because it can be a little harder to do just by itself. So I find it easiest to do this one, and then this one, and then do the end pieces. So that's how you wrap them. And again, this is Velcro, so this is gonna kind of stick down to right here to where it stays down. And next things is how tight is this going to be, right? So you don't want to do it super tight to the point where you start to get numbness and tingling in your fingers. If it's that tight, it's too tight. But you want it snug. You want to at least be able to get a finger underneath. So I can barely get a finger, so it's a little too tight for me. So I'll undo it just a little bit, and I'll put it back. And I can get a finger pretty easily, like snug underneath here. So these are going to be the main things. Now these dials, which will likely be set already, but this is going to be the thing that locks the brace, right? So right now it's unlocked, meaning it's down or going towards the hand. So I can move my elbow, I can straighten it, and I can bend it. And then when this is pushed in, this is pushed inwards, it's locked. I can't move it at all, right? So if this is up, it's locked. When it's pushed down, you can straighten it and bend it all the way. And these little dials here, these just show us kind of the degrees that you can flex or extend your elbow. And likely this will be set by a physical therapist or changed by one of the physical therapists if you're going to physical therapy. But basically how this works or how you change it is you just pull this gray part and you move it to the amount of degrees. So that's what we'll basically do to change the amount of flexion and extension. Flexion being how far you can bend your elbow, and extension being how far you can extend it. So again, basic things, make sure that it's long enough on the forearm as well as high enough on the shoulder. Make sure this is right at the elbow joint itself, right where the elbow bends. Make sure these aren't too tight, and we hope you have a speedy recovery.